3, 2. Hello, everybody. Good afternoon, and welcome to our weekly COVID-19 media briefing with Montgomery County Executive Marc Elrich, also with Health Officer Dr. Travis Gayles and Dr. Earl Stoddard, who is the Director of the Office of Emergency Management and Homeland Security. I'm Lorna Virgili, Hispanic Public Information Officer, and for members of the media, you should all have already permission to record. If you do not, please utilize the chat to ask for it. And we do have a hard stop today at 1:25 in the afternoon. With that, I toss it to you, Mr. County Executive.
Good afternoon, everybody, and thank you again for joining us today. I'll start by updating you on our COVID numbers. Today, our case rate is 7.82 cases per 100,000, and our positivity rate is 2.05. The positivity rate is the third lowest in the state. There are only 2 counties that are lower than us, and our cases per 100,000 today is the lowest number in the state. This week, we went over 50% of our total population receiving at least 1 dose of the vaccine. Good news yesterday, the Board of Health passed unanimously our guidelines for fully reopening the county in phases tied to vaccination rates. Now that we've got a reliable supply of vaccine, more or less, at least we know where we're going, it makes sense to start looking at vaccination rates. As I mentioned last week, by tying our reopening to vaccination rates, this is going to incentivize our community to get vaccinated as soon as possible. The more people that come out and get their shots, the more things will open. And we're optimistic that people will continue to get vaccinated. Although most of you covered this yesterday, I want to take a moment to repeat. Phase 1 began yesterday as we were over 50% of the population receiving at least 1 dose of COVID. Phase 2 will begin when 60% of the population receives at least 1 dose of COVID vaccine. That should probably be a few weeks. And Phase 3 will begin when Montgomery County is at 50% of the population being fully vaccinated with COVID-19 vaccine. All conduct and business in Montgomery County must follow state or Maryland Department of Health requirements in place at the time. Fully vaccinated means 2 weeks after a person has received all the required doses of the approved vaccine. So for Johnson & Johnson, it's 2 weeks after your only dose, and for the others, it's 2 weeks after your second dose. As far as face masks guidance goes, Montgomery County continues to follow the guidelines from the CDC and the Maryland Department of Health, whichever is stricter. The new regulation provides an exception for sports activities that allows the removal of face covering during vigorous outdoor exercise for high heat and humidity. We do expect Governor Hogan will be announcing more about all this later today. As we move forward, the likely question is, what is the right speed for reopening? And, I continue to believe, and our health officers believe that we are opening exactly when we should and how we should. Although it's good news that the state COVID case rates have dropped over the past week, if you look at the comparison of case rates between Maryland and Virginia over the past month, it clearly shows that we opened too fast, too soon, and cases surged. Maryland, which was running below the state of Virginia, jumped over the state of Virginia. I'll also say, in looking at our own numbers, we are relatively unique. In fact, we are totally unique in terms of the large counties in the state of Maryland. And if we had not done what we had done, if we had followed the path that led to double and tripling of the case rates in many counties, and there were counties that had 3 times as many as we had at our peak this last time, that would have added hundreds, if not 1,000 or more cases a week to Montgomery County's total. So our decision in being able to keep case rates down in Montgomery County led to far fewer infections that would have happened if we had chosen a different path. And I just want to remind our residents that, again, we could say anything we want, but it's the fact that you followed those guidelines and adhered to them that has made it possible for Montgomery County to do as well as we have. And I'm just encourage people to help us get through this last probably couple of months of really hard numbers where we have to achieve some higher goals. stick with us so we can make sure that everybody stays safe. I appreciate the political will and cooperation of the County Council, as well as the understanding from the majority of Montgomery County business community. They get it. They see it in their businesses even now. I mean, I've been to a number of restaurants, and even though people can go back inside, most people are staying outside. The restaurants tend not to be at capacity, even the restricted capacity. I do certainly think that, we made the right decisions. And if we had made different decisions and our case rates had mimicked what happened around the state, I think people would have been very upset. Our goal, from the beginning was to make sure that as few people got sick and as few people died. That's what has driven these decisions from the start, and that's what's going to drive our decisions as we move forward. I never imagined that the pandemic would become so politicized. It is really unfortunate to have people without the slightest knowledge of medicine or public health opining and demanding that we do things that maybe would make their lifestyle more desirable for them, but with utter disregard for the impacts those things would have on other people in the community. I'm not going to politicize this. We have never made political decisions as we made our health decisions, and we're not going to start doing that now. Johnson & Johnson and our vaccine supply, as you think you all know, the FDA and CDC resumed J&J vaccines authorization to be distributed, and we are following suit in Montgomery County. We are, again, waiting. I don't know, I may find out more in a few minutes, but as of last time I talked, we did not have a number on how many Johnson & Johnson vaccines were coming or when they would come, but we do expect the flow to begin. We paused distribution because it was very clear the CDC said we should, and that's what we did. With Johnson & Johnson back online, they still have the issue in the Baltimore plant. That's not clear that they'll immediately reach the levels of production. To be honest, nobody has reached the levels of production that people were anticipating. Montgomery County's own Novavax is about to go in for approval of their vaccine. They've completed their trial, put their data together, and we're really eager to see their supply come online. They've already begun production. So our hope is that they'll actually add to this equation and pick up some of the slack that's occurred because of the problems with Johnson & Johnson and the lower than expected production. So we have to focus now on the hardest part of obtaining herd immunity. We're doing this the right way. We're not making people sick to achieve herd immunity. We're going to get people vaccinated to achieve herd immunity. And we need to convince those people who are hesitating to take the vaccine to take it. I'm concerned about the hesitancy. We know we have to get up to 70 to 80% vaccinated to achieve herd immunity. There's not a precise number in there at this point. But the longer a reservoir of vaccine remains in the community, people will continue to get sick. And the worst thing we worry about is that the virus will continue to mutate. Every time it reproduces, and everybody it reproduces in represents a potential new variant coming to life. And that's why it is critical that we get as many people vaccinated as possible so there's little reproduction of the virus as possible and as little mutation of the virus as is possible. We all know that mutations can be minor, and we've seen some of them. The viruses seem to still be affected by our vaccines, but we also know that mutations could make our vaccines much less effective. And that's why it's critical that we both get people vaccinated, but that we get to a level where we have effective herd immunity. So far, 17% of our population is not yet eligible. There was news today, and I know Maryland's playing a role in these trials of vaccines in children, and they expect to have, if I read the article correctly, some sense by the end of the summer whether children can be safely vaccinated, and that would be another important step forward that would help, again, reduce the potential reservoir that would be sitting in the community. According to our CEC team, hesitancy based on several weeks of outreach seems to be tied to religious beliefs, privacy, and confidentiality. Too much hassle to get the vaccination. And I have to say on that one, the lack of the state providing a centralized registration system did make getting vaccinated far more challenging than it should have been. A lot of people got discouraged, but we want people to know now that you don't need to be discouraged. And on the county, you can still pre-register. We are still scheduling vaccines, and we just want you to step up and get yourself registered and ready to get vaccinated. And there are people who don't believe it's urgent and they want to wait, and they're looking at our declining numbers and thinking, oh, well, this might go away. This is not going to go away. Certainly not all by itself. If it goes away, it'll be because of all the things we do, but this is not going to vanish any more than the flu has vanished. We still need folks to pre-register, and it's a lot easier to do that now, at least on our site. We can plan out when you sign up, and you should be able to get vaccinated within a reasonable amount of time. Last weekend, FEMA and the Maryland National Guard held a mobile vaccine clinic at CASA's headquarters in Langley Park. We need to get more direct engagement like this, and we're actively coming up with action plans and communications to make it as easy as possible to get vaccinated. And this week, again, with Novavax preparing to be authorized, it's also good news for Montgomery County because, we have been at the center of a lot of this vaccine and health development, and it kind of reinforces where we stand in the world in terms of being a center of this kind of medical research. We are in the middle of Montgomery County MoCo Eats Week. It's one industry where we're reaching out both to help increase vaccinations and also safety as we open our restaurant industry. We would encourage all the employers to facilitate getting their employees vaccinated if it means allowing them the time to get into the vaccination sites. Those are the folks who are most exposed. They're working in an environment, 8 hours a day, where lots of people don't wear masks because all you have to do is go into a restaurant and people are eating, and you'll see how much time people spend without their masks on. So it both leaves the workers vulnerable and it leaves the people dining inside vulnerable. So we encourage our restaurant industry to work with us to make sure their employees can get vaccinated as quickly as possible. And I want to encourage everybody from MoCo Eats Week to go out and patronize our county restaurants. I've patronized a few of them so far. I got to say, it is nice being outside and sitting down and eating lunch with somebody. I'm vaccinated, so it's an easy thing for me to do. But it's just, I think we're all going to find we've really missed this more probably than we realize. The first time you sit down with people and enjoy having a conversation, you're going to realize some of the things we've missed through all of this. During Restaurant Week, there's no set menus or limitations. It's open to all food and beverage businesses to participate. And we're just asking that whatever you do, you create with county safety protocols in mind. There's a digital savings pass that includes over 50 deals available at mocoeats.com. You can check in participating locations to win restaurant gift cards and one of 6 MoCo staycation packages. I just wanted to take a moment to thank all the restaurants for their resilience and compliance over the last year. I know full well that you have been, you and the entertainment folks, among the hardest hit industries, not just in the county, but the country. We did what we had to do to keep people safe, but we understand that it had consequences. And, there's more federal money flowing, more state money flowing, and we'll be doing our part to make sure we provide as much assistance as we can to the people who've been hit hardest, whether it's an individual renting an apartment or a business that's had to close its doors and not operate. And I'll stop talking here.
Thank you, Mr. County Executive. Dr. Gayles, opening remarks.
Good afternoon, everybody, and happy Wednesday. My remarks will be very brief to save time for questions. I did just want to highlight a couple of the points that the county executive mentioned, particularly the community transmission levels we are the lowest in terms of rates and one of the lowest in terms of test positivity And we do thank our residents for adhering to what we've asked them to do in terms of the restrictions and policies that we've had in place that have driven those numbers to be low in comparison to the rest of the state and the region. And we feel strongly that we are able to see significant improvement in the state level numbers as well, in large part due to the contribution of the efforts we've taken on a local level. I also wanted to clarify a couple of points that were brought up in our council briefing yesterday, as well as the county executive mentioned. We did look into two questions. The first one was, what percentage of our residents are missing second doses? There was a national report over the weekend that suggests that nationally there are approximately 8% of folks who've received the first dose of their vaccine who are not following up for their second. And when we looked at our numbers, we saw that 6.3% of our residents who had received a first shot had not followed up and completed a second shot. And that was defined by after 42 days of receiving that first dose. And when we break it down by race and ethnicity, that number is 3% for Hispanic residents, 4% for Asian residents, 5.7% for non-Hispanic Black residents, 6.1% for non-Hispanic white residents, and then there's a 14% rate for those who are other or unknown. The second question that we looked into was, where are folks getting their doses, to have a better understanding of where to kind of concentrate our efforts. And when we broke that down, we found that by race and ethnicity, that white residents, 53% had received their doses in county versus 47% out of county. For Black residents and Asian residents, 63% received their doses in county versus 37% out of the county. And for our Hispanic residents, 62% had received their doses in county versus 38% out of county. And then when we break that down even further, looking at the types of sites where folks are going, the take-home points are this: white non-Hispanic residents utilize the state mass vac sites heavily. And looking at the data, 21% of those vaccinated were vaccinated at a mass vac site compared to 21% of county-related operations. Black residents rely more heavily on the county health apparatus and local hospitals and less on retail pharmacies and grocers. 29% receive their doses through the county apparatus, and that includes the county sites as well as our community partners who we've provided with doses, compared to 11% of mass vac sites. When we look at our Asian residents, 26% receive doses through the county apparatus compared to 14% mass vac sites and 27% pharmacies. And our Hispanic residents, 27% receive doses as part of the county apparatus compared to 27% of pharmacies and 14% of the mass vac sites. So wanted to put that information out there to let folks know that we're continuing to look at our data to refine the work that we're doing to make sure that we have maximum impact in terms of getting doses into folks' arms. We don't have any further updates, the county executive mentioned, on Johnson & Johnson dose allocations as well as mask guidelines. I suspect that the governor will probably have some comment on at least one of those issues in his press conference later today. Thank you.
Thank you, Dr. Gayles. Dr. Stoddard.
Thank you, and welcome back to everyone for joining us again. I'll keep my comments to 2 minutes to save us more time for questions. First off, with regard to the Johnson & Johnson doses at the mass vaccination site in Germantown, we did have approximately 1,300 left over from when the pause was initiated several weeks ago. Because clinics were already scheduled for this week with Pfizer when the pause was lifted last week, the first opportunity we will have to schedule additional appointments using this Johnson & Johnson doses will actually be Monday. So that will be the date we'll reinitiate at the mass vaccination site with those 1,300 doses. With regard to an additional opportunity that's come to the county, the state and the federal FEMA, the Federal Emergency Management Agency, have been doing mobile opportunities across the state. They did approach us with an opening that they had actually this week. They approached us on Monday. We were able to facilitate their arrival. They're actually helping augment our Silver Spring Civic Building operation today, and we'll be out doing additional clinics in the community tomorrow through Sunday. This is not in lieu of, but rather in addition to the opportunity that we've been approached about May 11th through 17th. And we're also just received a message today that they may be interested in supporting us the week of May 5th as well, including with the mobile trailer, which is actually fully deployable, doesn't actually have a hard building. And so we're going to be continuing to work with the state on identifying opportunities for use of those clinics. They target areas that have been disproportionately impacted by COVID-19, particularly in our with Black and brown residents, as well as zip codes where we've seen lower uptake of the vaccine. So those mobile opportunities are really effective in increasing those. So that's all I have. I wanted to mention, and we can take questions.
Thank you very much. Gentlemen, we have a first question from Dominic Monesi at WAMU for you, Mr. County Executive, and also for both of you doctors.
Hi, this is Dominique Benessi from WAMU. Thank you guys so much. Really appreciate it. I just have, I'm not sure if this question would be for Dr. Gayles or Stoddard. Just curious to know, I mean, I know there's no exact number on herd immunity, but ideally, or what will it take to fully reach that herd immunity that you're looking for?
So we've been hesitant to come up with a specific number for the herd immunity piece, given that there's a lot of other factors that have influenced transmission, including the variant strains that have taken over as the dominant strains, as well as ensuring that we've got to get eligibility for the younger populations to also be covered in terms of getting vaccinated. So the numbers that have previously been thrown out is somewhere between 70 to 80% in terms of achieving that. But again, those numbers are contingent upon, the continued impact of the variant strains, as well as the eligibility criteria for the entire population being eligible for the vaccine.
And then just two more questions, and these are related to each other. Yesterday, during the public hearing regarding the restrictions some restrictions being lifted, there were parents asking about, whether kids on sports fields would be able to not require them to wear masks now that the temperatures are getting warmer. Does the mask mandate that you're talking about, County Executive, with no mask needed for high heat and high humidity situations, does that apply to sports fields and players? And then the second one is, another county residents are asking about when libraries might be able to open safely. Is there a plan to open libraries?
So I'll talk about the libraries first. They are working on a plan to open libraries. We still have to deal, our libraries are actually open. I want to start with that. Anybody who wants a book can actually, go online, browse the collection, order books. People will bring the books outside. So if people want books, there is no impediment to getting books from our libraries. The issue is whether you can come inside and browse in a library. We are working on a plan to do this. We have shortages in staff in the library because obviously without knowing when we were going to be able to reopen the county, we did not rehire or hire people for empty positions that we would then pay for not being able to work in those empty positions. So as we approach, a sense of when we're going to open them, we'll begin a hiring process so we can increase the staffing. So I'd anticipate that we'll open some libraries first and do kind of a rolling reopening. The mask wearing, I'll defer to the health officers on what this means. And maybe Dr. Gayles or Dr. Stoddard can answer that.
Sure. So the expectation is there has not been any relaxation of the requirement of face coverings to be worn into those youth sports activities. And this is consistent with recommendations from professional societies. It's consistent with our own anecdotal information where we have seen cases of transmission on the field of play, both indoor and outdoor sporting activities, where folks have not been able to physically distance and they've not had on face coverings and have transmitted across the field of play. Now, the provision for heat and humidity was put in to mitigate any potential risk that some folks may encounter if those temperatures reach a certain point and there's humidity levels. We search through professional society guidance and other guidance, and there aren't clear parameters to determine what temperature that is or what humidity level that is. And so we have put that provision in and, you know, left it to the discretion of those officials of those particular activities when it does get hot and the heat index is elevated to be able to make those decisions. But from a global perspective, the expectation and requirement of face coverings to be worn in those settings has not changed. That is still a requirement.
Very well, thank you. The next question comes from Tim Carney, Washington Examiner, and it is for you, Dr. Gayles.
Dr. Gayles, going back to the summer when there was a battle over closing private schools, there was an email you sent to the staff, which came to my attention through an MPIA request, where you said, "It has been a long day and the privileged class of the county is showing their behinds," as my grandmother would say. So I want to ask you first what you meant by that.
Well, thank you for your question, Tim. I'd be happy to follow up with you after this. My questions in terms of pulling out emails and MPIA requests are able to take emails out of context and cast a light in terms of how you'd like to print your story. Again, we'd be happy to follow up with you after this, but the message that we are consistent with and stand by the guidance that we've put forward in terms of the actions that and guidance that we've recommended, we stand by that guidance and we stand by what we've put forward.
Thank you, but I'm not taking anything out of context. I've shared the screen. I don't know if that's visible. It's the entire email exchanges here. And so you can look at that. I will send that to you. But follow-up question on the school closures. Numbers your office sent me suggested that there was exactly one hospitalization related to COVID among the approximately, I don't know, more than 8,000 students, faculty, and staff who were in person between September and March when the county opened the schools. So that seems to suggest that the schools did in fact do a very good job of keeping the students, faculty, and staff safe. And the rates of spread among in-person schools was certainly not higher than the rate of spread among minors around the county. So was it a mistake to try to close the schools? Why did it not turn out dangerous?
Well, as you also know, we have an ongoing lawsuit litigation around this area, and I can't answer some of those more details in more context. Again, as that litigation is moving forward, we have put forward, again, the numbers that have shown we had additional outbreaks and investigations involving a number of our schools, as well as a number of sports-related activities and youth-related categories.
Okay, thank you. The next question comes from Brianna at Ikusuma from Bethesda Beat, and there are questions for you, Dr. Gayles, and also for Dr. Stoddard. Brianna?
I had a question. I guess, Dr. Stoddard, I don't know if you want to address this. Your audio went out a little bit for me. When you mentioned there were 1,300 leftover vaccines, is that Johnson & Johnson? I believe the shelf life is 2 years when stored at a certain temperature. So could you confirm if you all didn't have to throw any of those out because of shelf life? And then how many vaccine doses did you all receive this week total?
Oh, I'll unpack that one at a time. So the 1,300 were Johnson & Johnson that we still have at the mass vaccination. It's just specifically to the mass vaccination site. There's a separate pool that is the county. Just to be clear, the mass vaccination site is treated separately from the county doses because it is a state site. We want to keep those things separated. The mass vaccination site had approximately 1,300 doses remaining when the pause was enacted. So we had scheduled clinics on that Tuesday, as you recall. It came in 7:30 in the morning. We had those appointments scheduled that day. We quickly swapped over to the Pfizer doses that we had received and had 1,300 Johnson & Johnson left, which we'll now be able to utilize starting on Monday when we have the next opportunity to schedule new appointments from when the freeze was implemented. We received the same amount this week as we received last week, which would leave 4,860 doses of Pfizer at the mass vaccination site and approximately 7,000 for the county health department side. I think all Pfizer as well. Dr. Gayles can confirm that. But that's sort of what we've received this week. We have not received our allocation, which will take place until for next week. We will likely not know that until Friday.
So the 1,300 was for the leftover J&J vaccines for the mass vac site. Were there any leftover J&J for county health department?
I believe Dr. Gayles has said
284 doses were left over and remaining, and we have been using those doses. We've restarted using those doses, particularly with our homebound population, where we had already identified where a one-dose regimen would be most convenient and easiest for them, given their logistical limitations.
Great. And is just following up to that, is there an update to how many homebound residents are left to be vaccinated?
Yes, so I can follow up with you the exact number, because in my head, I'm seeing the email report that I received last night on that. We looked at, I think yesterday we actually surveyed all of those folks who were still on our pre-registration list, who had indicated that they were homebound. I think we had approximately, of the 700 folks who we sent emails to, we received emails from about 250 of those folks. And we've been working to find out how many of those folks have already received the vaccine, as well as anyone who still needs an appointment, so that they can be on the list and we can make sure that we continue to get them covered.
Okay, thank you.
Okay. Thank you, Brianna. Thank you, Dr. Gayles. We do not seem to have any more requests from the media for questions. Going once, going twice. I guess we can wrap it up. Thank you, everybody, for joining us today, for participating. And, Kate Ryan here with one. Kate, go ahead.
Thank you very much. I appreciate that. In terms of the Johnson & Johnson, and again, the leftovers that you described, Dr. Stoddard, are they the only ones that are being offered at the mass vac site? Is that the only type of vaccine that's offered there?
No, so actually our primary allocation at the mass vaccination site for the last 2 weeks at least has been exclusively Pfizer. And so we will utilize the rest of what we have for this week's allocation of Pfizer by Friday, and would normally be waiting for a refill on Monday, which would normally come on Monday. And we're just going to utilize the Johnson & Johnson doses that are available to basically keep operating the site on Monday, as opposed to having to just do second doses. And so when people receive the invitation for an appointment on Monday, they will know that it's a Johnson & Johnson appointment. And if that's fine with them, they'll accept the appointment. If it's not fine with them, they would prefer to wait for something else, they can just not accept the appointment, and they'll be offered another opportunity in short order there, utilizing another vaccine. So you're not going to come to the site and say, I want Johnson & Johnson or I want Pfizer. You're going to be offered an appointment for a particular vaccine. If you don't want that particular vaccine for any reason, you don't accept the invite.
Got it. And then in terms of pre-registrations, you explained when we saw the allocations cut week after week that this would slow our progress, not that people would be discouraged or not get signed up, but that you simply couldn't do the numbers. Where are we right now with the numbers that are pre-registered? And do you see the county going to all walk-ups anytime soon?
We have about 33,000 and change, so almost 34,000 remaining to be invited. We're actually having a meeting with the team at 2 o'clock today to talk about some of those timelines from the public health team, to talk through both as it relates to the mass vaccination site, as well as it relates to other county clinics, and just figuring out what the relationship between those two things. I can say that, so as you recall, at the mass vaccination site, approximately 2,100 of the appointments per week come from the county's pre-registration system, of which there's about 34,000 names in that system left. And the remainder of whatever is allocated comes from the state's list. We have largely worked our way through the state's list. We have about maybe a week's worth of appointments left, and we're not getting them as fast as we're putting them out. So I do believe we will be moving to a different model, whether it's a full-time walk-up or a some sort of hybrid where we're doing walk-up plus appointments, or walk-up plus kind of like you can do in a pharmacy right now, where you can make your own appointment, because we're trying to make it convenient for people, because walk-up you can get a line. And so we're trying to figure out what the balance of different opportunities can be, where we have some appointments that are made in advance, some walk-ups, and giving people the options, because some people don't want to wait in a long line of walk-ups. Some people are fine with that, and they just want to go when they can go. And so we're working right now to figure out when that balance will transition to something like that. And it will be progressive. And so we're not going to just move to a new model and that will be the model for the rest of the pandemic. We'll move progressively to a new model each time the public's behavior or public's utilization of the system will tell us we need to. We're looking at extended hours, so the people who can not come during the day are available. We're looking at weekends. And so you're going to see those being integrated more into the mass vaccination site, as they already are being done at the non-mass vaccination sites, the county sites. And so you'll see that progression. And I do think over the next couple of weeks, you will see all those things start to happen.
Terrific. And lastly, teenagers. We saw the age drop to 16 plus. Are you seeing a growth in the number of those, say, 16 to 21 signing up to get vaccinated? And among those, is it possible to say, is that driven by athletics, by kids who are taking part in sports, who want to get on the field as fast as they can? And
thank you, Kate, for your question. We are seeing a slight, I would say, increase in the percentage of those pre-registering being the younger age groups, which makes sense given that they are now eligible to be able to get vaccinated. As best as I can tell, there hasn't been any, or at least I don't have any data that suggests that there is a correlation between that percentage of folks who are pre-registering and correlating with youth sports activities. Now, certainly we would love to see those folks vaccinated, given that youth sports has been tied to a number of outbreaks throughout the pandemic, as early as last year and continuing as recently as last week. And so I think it's important for all young people, though, to start thinking about being able to get the vaccine, particularly those who are already eligible, 16 to 18, for the Pfizer shot. But as we continue to increase availability and eligibility for kids younger, hopefully that will be approved in the near future, we want to make sure that we continue focused outreach to parents and to those kids to help them understand why it's important to get the vaccine, to ensure that when they are deemed eligible, that they are getting the shots in their arms, because they are included when we talk about that percentage of our population who has been covered. They are included in that number. So it's important, in order for that number to rise, that percentage to rise, that we see increased participation with those younger groups as well.
got it. Thank you very much.
We're also working with MCPS on a regular basis, including most recently this past Monday with Dr. McKnight and others from the team to talk about communicating to the 16 and over population within MCPS. We're actually scheduling, I believe, for next Friday, another non-public school meeting as well to talk through some of that, how we can increase information provided to young people and their families about getting vaccinated. And obviously, we're preparing for a day when, the CDC, the Pfizer submitted on April 9th their request to expand to 12 and 15. And so obviously we are preparing for a time when there will be opportunities for even young adults.
So
Thank you.
I just wanted to add something about young people. While you were talking, I've been looking at a couple of databases. I just want to point out that new cases now for the age group under 18, they're comprising about 22% of our new age of the cases. Their percentage of the population is about 22 or 23% of the population. This wasn't true before. And so if you look at the cumulative cases for that group, their cumulative cases were probably closer to 15% from the beginning. And so what's changed is that they're getting infected basically proportional to their portion of the population now. That's a change, because, in the beginning, we would say almost no kids are getting sick. This is mostly in the older age groups. This isn't simply a percentage change because the seniors are out of the equation. Their numbers correspond to their population cohort now. And that's that's concerning. If you look at the total number of cases, 0 to 19 is about almost 70,000 cases. That's a lot of cases over time, and it's growing. So that's one reason we continue to be concerned about children. It's why the study about how early you can vaccinate children safely is important, because if we're going to control this, we're going to need to be able to do that. We're going to need to be able to vaccinate children. But we just shouldn't, for a long time, we just said, kids don't get sick. Not so much. They're getting sick.
Got it. Thank you very much.
Thank you, Kate. We have about 5 minutes left. One more question from Caitlin Pitts at Bethesda Beat. And if we have time, a follow-up also from Brianna at Bethesda Beat. Caitlin, pardon me, you first.
Hi, thanks. Mark, I have a question for you, actually unrelated to COVID, but in 2019, if I'm remembering right, you asked Montgomery College to consider an Eastern County presence, which they've done, and now the Board of Trustees has authorized the college to move forward with making that center a reality, but it's contingent upon funding to make that happen. I just wanted to get some insight from you about why you felt that is a necessary step, and if and when you're committed to providing that funding.
So they're just completing their work. They've got to actually now determine what exactly the shape of this project is going to look like. They determined feasibility, and the answer is yes. We will work to build this in to the coming budget. We'll work with the state because they get funding from the state as well as from the county. I thought it was really important because if you look at Montgomery County, Montgomery College starts in, Tacoma Park, and all the other additions are on the west side of the county. And we've got this huge corridor, Route 29, on the east side of the county with no presence. And I thought it was important to provide the same educational opportunities in that part of the county as we are in other parts of the county. So I was really excited that they confirmed that there's a need for this and that they want to move forward on it. They're going to look judiciously at using existing sites, which will bring down the cost. We're not looking at building a new campus tomorrow, but there are, no surprise, vacant office buildings that are proximate to this area that they can use. And they'll develop a longer range plan, and we'll work with them to make sure we can finance that longer range plan. This is good news for the East County, which I think has long been neglected in terms of, the services we provide over there.
Thanks.
Thank you. I think we have a couple of minutes. We can squeeze you in, Brianna, with your follow-up question. Go ahead.
Yeah, I just had a quick question for Dr. Gayles. The CDC has noted that women younger than 50 years old should be aware of the rare but increased risk of the blood clots associated with the J&J vaccine. What would you say to women in that age range who are concerned about getting this vaccine, or if they would like to figure out if there's a different way or a way that they could get a different vaccine? What would you say to them?
Well, thank you for your question, Brianna. That's actually an important conversation to have. And I think in any situation, I would encourage folks, if they have concerns about a particular treatment or some type of other modality, is to ask questions and to speak with your provider to get those questions answered, or reach out to the numerous resources that have been made available at the county level, the state level, and the federal level to provide more information related to vaccines. Now, certainly, what I would say is that, yes, it's cause for concern when you do see the report of those cases. They have all been in women ages 18 to 50. But at the same time, I would also say that, yes, there were those 15 cases, but there were over 8 million other folks who received the vaccine. I would imagine probably 60% of those have been women so far, as women have been outpacing men in terms of getting the vaccines of all three different types. And the overwhelming majority did not have those complications. So what I would say is to do the due diligence and reading up to help answer those questions. But again, the overwhelming majority of folks who did receive the vaccine did not have those complications. And yet, if there's still concerns, which we understand, there are also other vaccine types out there that could present an alternative to the vaccine, including both the Pfizer and Moderna doses, that as best as I can tell and has been reported, has not had any of those potential complications reported.
Great, thank you.
Well, thank you everybody for participating today. Thank you, Mr. County Executive, Dr. Gayles, Dr. Stoddard, and thanks, reporters, for joining us again. We'll see you soon. Stay safe. Have a great afternoon, and thank you.
Thank you all.